I'll speak to virologist Mohammed Munir. He joins us live via Skype from Lancaster here in the UK. Can I ask how sharp a spike you expect to see in COVID cases, particularly in the US, where we were just mentioning it being a very busy travel week actually, in the US, the UK and Europe after the Christmas holidays?
Well, I think this is really sensitive, particularly because we were having already increased number of cases going exponentially high, and then Christmas and the festive season is already a problem for many of the other infectious diseases, primarily because this is the lengthiest time for the holidays, and at the same time we are hearing about the emergence of this new variant in other countries other than the UK. So all these together are perfect breeding places for the SARS-2 virus. So unfortunately, there would be very good situation in coming weeks, particularly by mid-January to early February.
What can you tell us about the testing program, perhaps here in the UK, but obviously something that you might see replicated in other parts of the world? You said that you were screening people, and some worrying signs around asymptomatic cases.
Yes, absolutely, Mariam. I think one of the major stumbling blocks for controlling this infection has been that asymptomatic number of people are significantly higher than the people who observe the clinical sign. So this means apparently people think that they are healthy, they are fine, but in principle they are carrying the virus. For example, just to put into the perspective, today I screened around 32 samples, and all were collected from healthy people, and 23 of them were positive. So that means if these people would have been intermingling with other social contact with elderly people during Christmas festive season, they would be spreading the infection. So I think it is now the time for every government to really use the infrastructure they built to screen people, not only one time but quite frequently, so that we can identify the asymptomatic positive people.
Yeah, so it's sort of maybe positive on the one hand because it suggests that most of the people that catch COVID either don't display any symptoms, or they manage to recover. But of course, the problem is that while that is happening, they're passing it on because it's so infectious. What about asymptomatic cases with this mutation?
Yeah, that is the information we are looking into with the Public Health England to really make sure that this new variant is not causing any severity of the infection or will not have any impact onto the vaccine efficacy. But as it stands now, it seems like it is more transmissible, which is again one of the major concerns during festive season, that this virus would help further spreading the infection. And the problem is that we have noticed since the start of this pandemic is that more infections mean more hospitalization, and more hospitalization mean more fatality. So ultimately, even if it is not pathogenic, it would have a bigger toll onto the health.
And of course, we've been reporting on the different vaccination programs that are taking place in different parts of the world, different regions, and impossible to coordinate something like that or have it done simultaneously, which means that logistically, in terms of travel and disruption, we're going to be living with COVID for a long time, even after the vaccine.
Yes, absolutely. I think I want to make it very clear, although probably this is not the right time to have a worrisome news, is that the vaccine is there, which is certainly a very good start, but this is not a silver bullet that can end the pandemic overnight. We have to first vaccinate at least 70 to 75% of the world population, which is really a big challenge. We never practiced that much vaccination in a living history in this shorter time. And secondly, the capability for the pharmaceutical is not enough to reach every corner in the low and middle income countries. And then financial contribution by the SAPI, Gavi and the WHO isn't really sufficient enough to give the vaccine to everybody in the world who needs it. So we are seeing a great level of vaccine nationalism, which is probably one of the major challenges to see the impact of the vaccine in ending this pandemic.
Dr. Mohammed Munir, thank you very much.
Thanks for having me, Maria.